Welcome back, everybody. I'm Dr. Mick Pinckney.
And I'm Dr. Ryan Evenhouse.
Today, we are starting a video series on disc herniations. Some of our patients often have questions and concerns about what is a disc bulge, will I need an MRI, is this something that I have to have surgery or can I be treated on a conservative basis? So our hope is to shed some light on this very common issue.
So before we talk about disc herniations, the first thing we should address is what exactly is a disc? So in everyone's spine, in between each vertebra, there's a soft, squishy substance known as the intervertebral disc. And it's made up of two types of tissues. The first being a gel-like substance. It's in the very center, and that's called the nucleus pulposus, okay? And then the outer layer is called the annulus fibrosus, okay? It's a firm layer that's almost more ligamentous, okay? It's there to create a cushioning in the spine as well as assist with movement. And sometimes when we frequently move in different directions, that inner gel can push on the outer annular layers, which is normal, but over time or frequently done, that outer layers can start to bulge, okay? And that's what's called a disc bulge. And if that's not addressed and treated, sometimes that bulge can have some tears, and that gel can push through those tears and eventually herniate out back where the spinal cord is, and that's called a disc herniation.
Oftentimes we will see two groups of people who present with suspected disc bulge. That first group is someone that already has an MRI or imaging performed and they're looking for a second opinion or a different approach to treatment. What we want to do is clinically correlate the imaging with the symptoms that the person has. So specifically, an MRI sometimes can show an asymptomatic disc that has no symptoms coming from that disc and has no relevance to the back pain that they're providing. The second group of individuals that we present is we are their first contact with that type of a problem that they're experiencing. We're going to go through a very thorough examination, checking sensation, reflex, strength. For instance, with the lower back, we want to be able to make sure that the person can raise up on their heels, they can raise up on their toes. Research shows that most of us will never need an MRI or be a surgical candidate if we have a disc bulge. Most disc bulges are treated conservatively unless the person is experiencing a progressive neurologic weakness or loss.
And we'll talk a little bit more about what that means in our later videos, but a couple symptoms that you should be aware of is if you're experiencing some numbness and tingling in the groin area, or if you're having trouble starting or stopping going to the bathroom, those are serious symptoms and can be a medical emergency, so be aware of those.
For complete rehabilitation of Dr. Mick Pinckney,
I'm Dr. Ryan Evenhouse.